Men with incontinence, if you are a middle-aged or an older guy, or if you are a prostate cancer survivor and you have incontinence issues, this video is for you.
If you have male incontinence, we're talking about somebody who's leaking urine like a slow drip faucet throughout the day, or somebody who might be completely wetting themselves due to urgency or frequency and they just can't make it to the toilet.
So in this video, we're going to talk about causes of male incontinence, and we're also going to give you some strategies to work on addressing and fixing that issue. Hey guys, my name is Dean. This is Manflow Yoga. I've brought along Lance Frank, who is a pelvic floor specialist and physical therapist. This is what he specializes in on a daily basis. So we're going to go through this issue. He's got a bit more experience than I do in this realm, and then we'll give you some strategies that you can use to help working on it. So Lance, take it away.
So when we're talking about somebody with male incontinence, we're talking about somebody who has this consistent slow leak of urine throughout the day, or also somebody who is completely wetting themselves and having urine accidents due to urgency or frequency, having to go to the bathroom all the time, and they're just not quite making it to the toilet in time.
Got it. And who are people that commonly experience this?
Typically people that might be older in age, their tissues have gotten a little weak over time, or people that have gone through some sort of cancer treatment that their tissues might have been fried from radiation, or they had some sort of surgery that the tissues have been damaged, so they also need a little bit more strengthening.
Got it. So what are the main things that we can do to start fixing the issue or improving it?
So first is learning how to isolate those muscles and recruit them appropriately, and then strengthen those muscles in addition to incorporating that isolation into other larger exercises like squats or deadlifts or lunges.
Got it. So if I were a patient at your clinic, how often would you have me doing these exercises, and how long would it take for me to notice improvements?
You would be doing these exercises to start off twice a day for the first few weeks, and then progressively once a day for the next few weeks, and then over time, we generally see people working through these exercises on a 6 to 8 week spectrum, but people continuously work on these exercises for the rest of their lives, even once they finish therapy.
So how long do these workouts take, and are the exercises appropriate for someone who is in the older demographic?
So these exercises shouldn't take people longer than 15 to 20 minutes, and especially if you're incorporating them into your already daily or weekly fitness routines, they shouldn't take you long. And if somebody isn't the most physically fit or active, these exercises are still appropriate for you because everybody's got to start somewhere. So we're trying to improve your overall general strength and hip strength and pelvic floor strength, and so these exercises are appropriate for anybody.
So what are some of the exercises that you'll have people do specifically?
So first, I always start off having people learn how to control the pelvic floor specifically. So learning to isolate the pelvic floor and make that mind-body connection, and then working on isolation and strengthening at the same time. So there's pelvic floor specific exercises, and then we incorporate those pelvic floor specific exercises into larger movements, like I mentioned, like squats or deadlifts or lunges or bridges.
Got it. Well, we've actually prepared this workout for you guys. So if you know that you have incontinence issues, if you want to work on strengthening your pelvic floor, there's a link in the description below. Lance and I made this video together. It's our gift to you. Click that, watch it, do it regularly. It's easy to do. You can do this regardless of your fitness level. And then make sure to like this video if you found it helpful. Leave a comment if you have some feedback or a question. Subscribe to Manflow Yoga so you don't miss out on our videos, as well as our entire pelvic floor series. And then go follow Lance.
You can find me on YouTube, Instagram, TikTok, all at Lance in Your Pants, or you can check out my website, flexptatl.com.
Sweet. All right, if you haven't clicked that video yet, here it is. This is a workout to help you strengthen your pelvic floor, and we'll see you on that workout.